Hello, my name is Peter Chalmers, and this is a surgery I did with my partner, Dr. Travis Mack, for both release and debridement and an allograft of what's called the capitellum. So you see, we've already made an incision. We're working here behind for our fascial split. We're going to use this to get all the way to the back side of the elbow. And the first step in the surgery is going to be to remove loose bodies and bone spurs from the back side of the elbow. So the first thing, we'll remove a bunch of extra scar tissue here called the plica. So you see me here taking that out of that's one of our first steps, remove that from the posterior side of the joint. You'll see that coming out. Once we've removed that, we'll have a better view of the joint. We can begin to work just beneath the triceps tendon to remove the capsule from the back of the elbow joint. You see us removing that here. And then we'll release the triceps tendon. In this particular case, there's no bone spurs in the back of the elbow, so we don't need to remove anything from the very back of the olecranon, but you see us here removing a little bit of osteophyte right from the edge of the joint with what's called the burr, just smoothing that off to make sure there's no bone spurs right there. Then we can remove this large loose piece, and this is where we're going to put our graft, where there's this loose piece of cartilage that I just removed on a portion of the elbow called the capitellum. You can see our view of that right there. We can just begin to see that big defect in the cartilage. Next, we'll make our split in the fascia and the muscle for the front side of the joint. So we create that split, and I'm going to carefully dissect here because I'm going to want to remove the capsule of the elbow because it's scarred and contracted. So I'm carefully working between the muscle and the capsule here. Once I've got that removed, you can see now that I have a plane in between the muscle and the capsule, and now I can remove that capsule. You can see me here carefully cutting that out. There's a big loose piece I've encountered in the interim, so we're going to remove that from the elbow. And here you can see that we're beginning to remove all that scarred ligament and capsular tissue from the front of the elbow. There's one portion of it coming out. Here's another portion of it coming out. Once that's removed, we're going to have a great view of the front of the elbow, and we're going to be able to see bone spurs that I'm then going to grind and smooth off with the burr. You can see me here working with the burr in the front of the elbow to remove all of those bone spurs and all of those pieces that can impinge. And once I've done that, now the elbow will have full range of motion. And those bone spurs can restrict the elbow from moving, so that's a critical step to confirm. Now we're going to try and work on our graft. So you can see here we can't quite see the graft completely from our split behind, and we can't get the pin quite in the right place in the split from the front. So you'll see us here in sequential steps working with different retractors, trying to get exactly what we need for exposure here to make sure that we can put the pin in the right spot, to put the graft in the right spot. And ultimately, you can see here us trying several times, and that every time we think that we've got it, we look and it's not quite right, and we have to remove the pin. So ultimately, we're going to have to take down the lateral collateral ligament here to be able to get a perfect view. Once I've taken down that ligament, you see me here completely releasing it, I'll be able to dislocate the elbow, which is what I'm doing right here. And now we can really see the true extent of that defect in the cartilage. It's huge in this case. It's almost the entirety of the lateral half of the elbow, the outside half of the elbow. So to do this graft procedure, we're going to be able to first use this pin to create a circular defect because the defect is not quite circular. So that pin looks like it's going to create a circular defect. We're using this reamer, create a cylindrical defect, and then you're going to see us later on bring in a portion of elbow that's taken from a cadaver. So this is fresh frozen. You can see how perfect it is there and how actually it really matches with our patient quite well. That's the cadaver. We're going to use that piece to substitute in for the piece that's missing. So to do that, you can see here we need to create exactly the same cylinder as graft. So we'll use that. We'll remount that cylinder. You can see the defect that makes within the graft that we have here in just a second. And we're going to then fit that into the cylindrical defect we created. Once that's been pushed in, you'll see that there's no more defect, there's no more red. Now you can see perfect white cartilage all covering the front of the elbow. So that looks really good. That's perfectly fitted in. It matches perfectly on all sides. And now we're ready to relocate the elbow and restore our lateral collateral ligament. I put sutures in that there. I'm going to bring, and I've confirmed here that that's in the right spot when I bring those through. I'm going to bring those through tunnels I've drilled in the bone using these sutures that I've placed as passing sutures. Once I use those passing sutures, those ligaments will come through the upper arm bone. We'll relocate the elbow, and then we'll tie those sutures. Tying those sutures will restore stability in the elbow, and will confirm, once those are tied, that the elbow has the appropriate what are called kinematics, so that it can bend and extend, and that ligament's at appropriate tension. So that looks right. I can bend the elbow all the way. I can extend the elbow all the way. So I know that my ligament repair there looks good. And now we're ready to repair those splits within the muscle that I made. so as to be able to see all the way through the front and back of the elbow. So here you see me here repairing these with an absorbable suture. And you'll see that once those are repaired, the elbow is going to look a lot like it did before we started. So that's the front split completely repaired there. And then I'll go on to repairing the back split. So again, front split tied, back split sutures passed. And again, once those sutures are all passed here, you can see now there's no more defects within the muscle. The muscle has been completely repaired. This is a muscle splitting kind of surgery, so this will provide full strength. And here I'm just over sewing our ligament repair to compress those ligament fibers down against the bone and ensure that they'll heal. Thank you so much for watching my video.